Happy New Year 2018 and Merry Christmas to all of you, especially for all of my patients and also for all of my family, my colleague, my networking. May God bless all of us to be repent, to be blessed and bless others, especially for the poor and needy. To have and give joy, love, hope, peace that creates wonderful world for the glorify of the Lord. I want to introduce myself. My name is Dr. Imada Laura Hanaparusis. Just call me Dr. Laura. I'm a medical doctor with 20 years work experience in almost every health field, and also the only one researcher of muscular dystrophy at Indonesia who are successfully to stop the progressivity of muscular dystrophy and increase strength muscle of muscular dystrophy for Duchenne muscular dystrophy and limb-girdle muscular dystrophy type 2B, especially for the if the patient is young, and also the access is low cost. And I'm very grateful for the government of USA, for the owner and teamwork of ORC, in total expert ORC International Minneapolis, USA, and that I am accepted as a world expert in total expert ORC International Minneapolis, USA since June 2012 until now. Right now, I open my private practices at Street Kebagusan Raya, Gang Krip, number 53, Jagakarsa, Jakarta Selatan, Indonesia. I also have my consultation online with my WhatsApp and cell phone numbers 6285219268188, and also my other cell phone number 6285930916695, and also my email address dr.laurainternational@yahoo.com. Right now, I'm going to introduce the newest and best treatment for spinal muscular atrophy with the name of the drug Spinraza or nusinersen. First of all, we must be grateful to the Lord for all the teamwork that product Spinraza, and also for all the patients' clinical trials who are involved to make the research successful, and also hopefully they are cured now. And thank you for the hard work and dedications with the best result that will be useful for all the patients spinal muscular atrophy around the world. And we hope in the futures that there will be developing for the treatment spinal muscular atrophy, muscular dystrophy, and also all the genetic disease with a capable price and with suitable form of the drug so it can be delivered and export to abroad around the world. I want to explain the disease of spinal muscular atrophy. Spinal muscular atrophy is the defect of GAN or mutations of GAN survival motor neuron. Yeah. Usually, the motor neuron, the function is for the movement and contractions of the leg and chest. Because of the defect of survival motor neuron, it degenerate and make the cells muscle death, and it influences. The effect is paralysis of the leg and chest. So, usually the onset for several weeks is the symptom is a general weakness of the muscle, loss of tone, difficulty of swallowing, and also difficulty of breathing or dyspnea. For childhood, the symptom is difficulty of standing up and walking. The symptom is much more similar with muscular dystrophy, but it's not muscular dystrophy because muscular dystrophy is the defect or mutations of the GAN, not for the survival motor neuron GAN. Yeah? So, spinal muscular atrophy will influence general weakness, which the lower leg is more weak than the upper leg. The area of the muscle at the shoulder is much more weaker in the arm, and also scoliosis that influence difficulty of breathing. And we are very grateful to the Lord that there are treatment for spinal muscular atrophy, that the name of the drug is Spinraza or nusinersen. Spinraza is a directed survival motor neuron 2 directed antisense oligonucleotides for the treatment spinal muscular atrophy, pediatric, and adults. Okay, and the administration is usually we put it in the warm and room temperature, and after removal from the file, we wait for 4 hours, and we take cerebrospinal fluid 5 milliliters, and we intrathecal for Spinraza approximately 3 minutes. And before we use Spinraza, usually we take a laboratory test such as platelet count, coagulation test, and urine spot protein test. Yeah. And also, the adverse reactions for Spinraza is 20% patients usually have upper respiratory infections, lower respiratory infections, and also we have there aren't any contraindications for Spinraza. It's okay. So warning and precaution is thrombocytopenia and coagulation, and also renal toxicity. And the other adverse reactions is constipation. Yeah. So I'm planning to make cooperations with the product of Spinraza, the company that product Spinraza, to deliver it to Indonesia. With hope there will be much more faster and easier way to get food drug approval as Indonesian Badan Pengawas Obat Makanan at Indonesia. So Spinraza cost will be much more lower than the import abroad. Hopefully will be equitable with Indonesia community, and if it's equitable with Indonesia community, it means lower cost than USA, than UK, than Europe, and it will be more attractive for people abroad to come to Indonesia to get treatment for Spinraza, and hopefully you can come to my private practices after we get FDA approval from Indonesia. With hope, with all of us can be cured with a keepable price and best results. Yeah. And hopefully in the near futures there will be developing research for treatment spinal muscular atrophy, muscular dystrophy, genetic disease with single injections or the form of oral form that's much more faster to make cure with best result and a keepable price. Now Spinraza needs for the intrathecal Spinraza for the first, second, and third intrathecal injection. The interval is about 14 days. And after the third injection to the fourth injection, the interval is 30 days. And for the maintenance, after 4 injections, is once every 4 months. Yeah. So we need to make it simple form. Hopefully not only injection, but oral drug, and much more faster to make cure. Hopefully can one injection or oral drug for only for a short period of time to make cure as soon as possible with a keepable price. And I hope the government and insurance can make very cooperation, can make very good and very honor cooperations to give Spinraza for the community with a keepable price. Yeah. By this way, it will increase the health. It will increase the prosperity of the company, and we will win the global competitions, and we can be blessed to bless others with judgment and fair in God's ways. And thank you very much. I hope by my explanations through this video, all of the viewer, all of the patients, all of the medical teams, all of the researchers, all of the government will be open-minded that with making very good and very honored cooperation, smart work, hard work, full dedication, with blessed from God, we can find the best treatment for spinal muscular atrophy, muscular dystrophy, genetic disease with low cost and simple form as and the short time period to make cure as soon as possible. So there will be no genetic disease in the future. Thank you. And there will be cure for genetic disease with best result, a keepable price in short time period with happiness in from blessing from God. Just to remind all of you, the cure depends on God, not on the technology, not on the doctors, not on the teamwork. But the cure, it depends on God, on your faith to God, on your pray, on your best effort in God's way. So there will be blessing to be cured and to make cure for the glorifying of the Lord. Thank you very much. I hope I can see you again in next video for many creative, innovative, adaptable treatment for many kind of disease and many ideas to make and to be cured, joy, faith in God that create wonderful Lord, wonderful world for the glorifying of the Lord. Thank you very much. Have a great and blessing day. Happy New Year and best wishes to be and to make cure, joy, faith in God, success for all of us. See you again from Dr. Imada Laura. Goodbye. Okay.